My name is Stephanie, and I'm a patient of Dr. Haddock. He's one of the people that, in a roundabout way, changed my life. You know, the whole situation with this was so strange to me because I randomly found a lump one day, and you know, I was a few months past my 40th birthday when I should have gotten my mammogram. And so of course I went and got one, and then there was, you know, biopsy and all these things, and they're like, well, we're gonna refer you to UT Southwestern. Cool, I've heard of it. I was new to Irving, so a little nervous. I meet my surgical oncologist and find out that she also went to Michigan State like I did. So that was my first sign that it was the right move. You know, she told me something like, breast cancer is more emotional than it is physical, the one that I have. And it kind of stuck with me. And then she said, you know, you'll have all these other doctors, your medical oncologist, your plastic surgeon if you want to go that route, blah, blah, blah. But we're ready to do whatever you want to do. And I opted to do the double mastectomy. And at the time, I wasn't sure if I was going to do any additional surgeries. But then I thought, I'm only 40 years old. Do I really want to have a completely flat chest at this age? And so I hadn't talked to Dr. Haddock about it yet, but I met a girl who had a DIEP flap. I'd never heard of it, didn't know anything about it. She told me her side of it, and I thought, science is so cool. So I talked to Dr. Haddock, and he brings it up without having to ask, but it was on my list of questions. And he's like, yeah, like, you know, let me explain the process to you. Like, you know, this is what we can do. And it's just like listening, like, it's so cool that modern science can do all these things. And I mean, who doesn't want like a little bit of a fix on their belly anyways, you know? And, you know, I went through that first, you know, I went through the double mastectomy and got the tissue expanders in. And then I had the DIEP flap about a year later because, you know, the way insurance worked and stuff, I had to wait. And it worked well for me. And then, you know, I've had a few revisions because I wanted to be a little bit smaller. I got spoiled for having the smaller size, but, you know, sitting and having conversations with him, he's a brilliant doctor, you know. And it's funny when I'm in the hospital and I'm waiting for him and I hear the shoes and I say, I know those shoes. I know that walk. He's like, all right, what do we got to do? And he takes his marker and he does this, you know, whatever he's got to do. And he's like, all right, cool. You know, see you in there. And of course I'm nosy, you know, I go in the room and I'm looking around and I'm like, it looks like a garage sale in here. There's so much stuff in here. You know, all these machines and everything. And you're only awake for about, you know, a minute, you know, before they're like, here's some oxygen. It's going to knock you out. Whatever else is in there. But my experiences have been so great. I absolutely love his admin, Lindsay. She's amazing. Anytime I've had to, you know, reach out for something, tell her, hey, put me on the list for cancellations. I'm ready to go early. You know, and his nurse, Molly, she's amazing too. Anytime I have to send him a message, I love his team. And then, you know, being in the hospital with his nurse, Jennifer, being the same person for every surgery, it's a really big deal to feel comfortable when they're like, you know, we have you back again. And I'm like, I know. But it's just been such a good experience for me, so much that I opted to come work for UT. So I became an employee after my mastectomy, and I've loved it. And, you know, I'm on a team now that actually, I'm in the clinical research side where I work on the budgets for our clinical trials. And so it's kind of come full circle for me with everything here. And it was the best decision for me. I didn't even feel the need to go outside to another doctor or anything from the start. I was comfortable. All of my doctors, my nurses, everybody from start to finish has made this experience so much easier than it could have been elsewhere, I think. It's one of those things where people ask you, you know, would you make the same decision if, you know, you had an option to do it over and everything. And I didn't have any issues with anything I did. You know, I don't regret doing the double mastectomy instead of doing a lumpectomy. You know, I got lucky. I didn't have to have radiation or chemo. We did the testing for the tumor to make sure that it's the kind of tumor that doesn't really come back as quickly as long as I stay on my medication. But all the conversations I've had with all my doctors and all the information they've given me, I've always felt like I knew exactly where I was at on my care, and the fact that I could always make the decision which way I wanted to go. To me, that was the most important thing, because I didn't want to let myself really think about it so much, because I lost my dad to cancer, and I felt like he didn't really have the choices I did. He had a blood cancer. He was diagnosed in June and he was gone by that February. And so when this came up, it just sort of, okay, here we go. But it was such a different experience. And I can't help but wonder, you know, if he'd been in Texas instead of Michigan, would we have been able to extend his life with the doctors that we have here? Would he have had a different experience? And you never know. But, you know, I still sometimes think about that. But for me, For what it is, it was the best experience it could have been. It's brought so much into my life. I've met so many good people. I don't know, it's just funny to think, oh, you had cancer, and then like you're smiling over it and you had a good experience. And you know, anytime I meet somebody that wants to ask questions about it, I tell them, I will tell you anything you want to know about any experience I went through. I will explain the DIEP flap surgery and what that looks like, and what the overnight in the hospital looks like, and all the nurses and all the conversations. And it's just, from start to finish, it was good. And I mean, knock on wood, I hope, you know, I never have to experience that side of it again and just finish out my current course of treatment. But it's been an amazing experience for me. I just hope that people realize that at the end of the day, as scary as it is, there's always something to look on the bright side, because I feel like it can kind of wake you up and make you realize how short life really is. Help you appreciate and realize the things that you do have in your life, and the people you do have to live for, and the life that you do want to live. It is weird, you know, when people ask you questions and you can sit here and smile and like be like, oh, I'll tell you this. And they're like, why are you like happy about this? I'm like, why not? You know, I mean, I got lucky at every step, because, you know, I caught it early and I didn't have to have chemo or radiation, you know, and all this. And it's like, why wouldn't I be happy about the process? I mean, yeah, you have to have surgery, but I just think of it as part of the whole thing that had to happen. You could have just let it go, and then where would you be? So I'm just grateful I caught it early, and then I was able to have really great doctors to, you know, get me through it. I think he's wonderful. He's so funny when he tells me, like, so what are we doing this last surgery? And I said, I need you to make these as small as humanly possible, we're still staying safe, because I feel like even if I really, you know, can get some weightlifting in and stuff, I still feel like they're way too close to my original size, you know? And I was spoiled. My tissue expanders were very small. And so he's like, okay, we got this. And so he does his little marker and everything. Afterwards, I was like, these are way better. You know, it's just, he's a great doctor. I think he's brilliant with like level of perfection. Like we got to make sure that this is right. And, you know, if you don't like something, we can fix it later, whatever we need to do. And that's the comfortability, because I'd never had a plastic surgeon before. That's the comfortability I think that you need to have with your doctor, to say, you know, hey, this is great, but like, I want this or this to be different. And he never once was like, I don't recommend that, or I don't think that's a good idea. He said, okay, you know, we'll see you in whatever time. Let's get you scheduled. Let's go. Like, let's do it. So, and I appreciate that, because it's not often that you have to tell somebody, hey, so let's completely change what you did. Not in a bad way, because, you know, I got spoiled for having the smaller size when I had the tissue expanders. And so, you know, we go bigger, which is close to my original size. And then I'm like, I don't like the original size anymore. I don't like having that size anymore. I got spoiled for smaller ones, so. He's a great doctor, and I love the team that he has around him. The team he has around him goes so far to making somebody feel comfortable. It speaks volumes for the person that he is too, because admins move on easily, nurses move on easily, and this is almost 3 years with him, I think now, and he has the same team with him. So that, I think that speaks volume, the kind of human being and kind of doctor he is, that he has the same team around him.